All right. Welcome back to NeuroClarity podcast, the Pearls and Oysters edition, where you get your weekly dose of clear, engageful, and insightful neurology. Our cases are derived from the journal called Neurology. I am Monowari Victor, your host, and today's episode is a fascinating case that highlights how a childhood onset movement disorder went misdiagnosed for 57 years as drug resistant epilepsy. This is a story about ADCY5 related dyskinesia or ADCY5-RD, a rare condition that is often mistaken for epilepsy or sleep disorders. Let us jump right into it. Our patient is a 59-year-old woman who was first diagnosed with epilepsy at the age of 2. She experienced repeated nighttime episodes of involuntary movements involving her head and limbs that lasted seconds to 30 minutes. There was no loss of consciousness and no post-ictal confusion. And for nearly 6 decades, she was treated with various anti-seizure medications, but nothing helped. The movement worsened after recent changes in her medication, and so she had to undergo a prolonged video EEG, and here's where things got interesting. Here's a snippet from her EEG. During sleep, the video EEG recorded countless choreoathetoid movements, twisting, writhing motions of the face, neck, and limbs, but of note, there were no epileptiform activities recorded on EEG. These episodes always started during early sleep stages in N1 and N2 of non-rapid eye movement stage of sleep. Even during naps, similar movements occurred. Now, this pattern ruled out epilepsy, and finally, after 57 years, her team considered another diagnosis. Genetic testing found a pathogenic ADCY5 mutation in P arginine 418 tryptophan, which confirmed the diagnosis of ADCY5 related dyskinesia. This gene affects adenyl cyclase 5, which increases cyclic adenomonophosphates in neurons, especially those in movement circuits like the basal ganglia. This brings us down to our question: what exactly is ADCY5 related dyskinesia? ADCY5 related dyskinesia is a hyperkinetic movement disorder, meaning it causes excessive involuntary movements. It often starts in childhood and the movements are paradoxical, meaning they come in sudden bursts. They are often triggered by sleep, weakness, stress, or emotions, and this disorder is genetic, often due to de novo mutation, meaning it appears for the first time in a patient without family history. Symptoms of this disorder may include chorea, dystonia, dysarthria, axial hypotonia, and even gait difficulties. Because these movements happen at night, ADCY5 related dyskinesia is often misdiagnosed, and common misdiagnoses includes sleep related hypermotor epilepsy, sleep disorders, psychogenic events, paroxysmal movement disorders, and even dyskinetic cerebral palsy. In fact, this condition wasn't described until 2012, so many adults still carry a wrong label or a wrong diagnosis. Now, here's the exciting part. ADCY5 related dyskinesia is one of the few neurologic disorders where caffeine, yes, you heard me right, caffeine, the one in your coffee, might help. And why is that? This is because caffeine blocks adenosine A2A receptors and reduces the overall activities of ADCY5 protein. In this patient, caffeine plus gradual withdrawal of anti-seizure medications led to fewer and milder episodes. Other treatment options include theophylline, which is just another adenosine receptor blocker, clonazepam and other benzodiazepine, propranolol, acetazolamide, trihexyphenidyl, but the results are variable and there is no formal treatment guidelines, at least not yet. What are our clinical perils? If you have paroxysmal sleep related involuntary movements in a child or an adult, think beyond epilepsy. Consider ADCY5 related dyskinesia in any long standing epilepsy that does not respond to medications, especially if video EEG shows no seizure activity. Genetic testing can make the diagnosis and avoid decades of ineffective treatments. That being said, here's our final thoughts. This case reminds us of a core neurology principle. Always match the diagnosis to the clinical picture. If something doesn't fit, ask again. Sleep related doesn't always mean epilepsy. Sometimes it's something much rarer, like ADCY5 related dyskinesia. Thanks for listening to this episode of NeuroClarity. Don't forget to subscribe and share with anyone interested in neurology, movement disorders, or just a good diagnostic detective story. Until next time, stay clear, stay curious, and keep learning. Bye for now.